With the ongoing debate in Washington, D.C. about the future of health care, Missouri Senator McCaskill just announced legislation to make sure people in Missouri have access to health care. Senator McCaskill is with us now to explain her proposal, especially with the individual insurance market and especially in Bexar County. Senator, what are you proposing?
Well, there's a possibility that there could be counties where the insurance companies withdraw from entirely in Missouri. And I want to make sure that if that happens, the people in those counties have choices. So it makes sense to me that they ought to have the same opportunity to buy the same insurance that members of Congress buy and their staffs buy. So what this bill would do, it would say if there is no insurer in your county for the individual market, for people who don't get insurance at work, then you can go to the D.C. health market where there is a number of national coverage policies and buy your insurance the same way members of Congress and their staffs do.
Do you think that that would end up being better than some of the options in counties that do have options or an option?
Well, it's certainly going to give them options because there have to be national plans in that exchange because so many members of Congress are from all over the country and their staffs are from all over the country. So it would be a relatively efficient way, and it seems to me that if it's something that Congress gets in their staffs, then the people in Missouri who don't have an insurance company in their counties ought to be able to use the same thing. Now, hopefully this is not necessary. This is a preventative bill in case counties are bare. If the Trump administration will pay the money to the insurance companies that they're owed under the Affordable Care Act, then we're not going to have a problem. But there has been some hesitancy, in fact, which has been undermining the current system. It's not Obamacare that's imploding. It's the fact that this administration is not sure whether or not they want to blow up Obamacare or whether they want to do something else. And I'm ready to talk about improving what we have. I want to improve it. But in the meantime, we've got to stabilize this because real people's lives are at stake.
Sounds like you want to address the uncertainties for those that might be on the plan in a county that may be in jeopardy.
That's exactly right. I want to bring some certainty so people don't worry that they're not going to be able to get insurance. But secondly, I want to work with my Republican colleagues and fix what we have. Let's repair it. Let's not put insurance companies back in charge. Let's not use this as an excuse to give tax breaks to wealthy people, which is what the House bill did. Let's not cut Medicaid by $840 billion. Let's fix what we have and make it better rather than tearing it up and starting all over with something that's more of a tax cut bill than it really is a health care bill.
And you opted out of DC HealthLink, if I read that correctly, where most in Congress purchase insurance and instead enrolled through healthcare.gov, the same way Missourians do on the individual market. How much has that choice, Senator, helped you understand the needs of Missourians in this?
Well, as you said, I turned down the employer contribution that I'm entitled to as a senator. I said, no, thank you. I'm going to pay for this myself, and I'm going to shop on the individual market exchange like other people who don't get their insurance at work do in Missouri, so I can walk down the same path. And I've had good coverage. I've bought silver coverage, which is the mid-level plan, but my premiums have gone up. I'm 63 years old, and my premium now approaches $700 a month, whereas it started at a little over $500 a month when we began Obamacare. So I'm aware that we need to do some things to shore up these individual markets, but we don't need to take the rules of the road away so insurance companies can go back to discriminating against people just because they've had the nerve to be sick before.
And I know, Senator, you have talked about that being one of the biggest problems you have with what's being proposed at the national level by Republicans is because it specifically affects the age group in which you happen to be in.
Well, no question. I mean, they're going to, you take a 60-year-old man that lives near Hannibal, Missouri, who makes $30,000 a year in a small farming operation. His annual premium under Obamacare is $2,500. His annual premium under the Republican plan that passed the House would be almost $14,000 a year, almost half of his income. That clearly doesn't work. For older Missourians between the ages of 55 and 65, the plan the Republicans are promoting simply is unaffordable.
I know that we wanted to talk about a couple of things. This next topic very related to health care in a sense, as far as prescription medication. Another topic you've been very vocal on, opioid abuse, and the fact Missouri is the only state in the country without statewide prescription drug monitoring program. Something I know you're even being vocal about on Twitter today. You wrote a letter to the governor recently. I know you've written a letter to the president before. What are you hoping to accomplish with this? And it's failed to pass in the session before. Why is that? And what are you trying to do differently this time?
Well, this is an issue, like many other issues, that we shouldn't be talking about Republicans or Democrats. I've asked the governor, and I hope he still considers amending his call for a special session to include the prescription drug monitoring program that a woman who's a Republican from the Boot Heel is working very hard to get passed. She's doing great work, even though we're not of the same party. I completely support what she's doing. We have a welcome mat out in Missouri for people who want to black market opioid and heroin. We're the only state in the country that does, and people are dying in our state every day of heroin overdose as a result of beginning down the path of opioid addiction with prescription drugs. We're the only state in the union that doesn't have it, and for the life of me, I can't figure out why this is so difficult for Missouri to get done in Jefferson City.
Well, and it's interesting you make the clarification in Jefferson City, because there are counties that have gone out on their own and are doing things that you would probably argue are successful.
Absolutely. In fact, we've helped them. St. Louis County, I know Jackson County is working on it. St. Louis County has gone live, along with a number of other counties that we actually have helped get them federal funding, because the federal funding was only set up to fund states. But since we were the only state that didn't have one, we were out of luck. So I amended that law in order to have counties be able to participate. But that's not the effective way to do it. It's not effective to monitor in one county and not monitor in the neighboring county. We need a statewide monitor. So I'm really hopeful that the governor gets on board, and I respectfully ask that he amend his call for a special session and help the many members of the Missouri legislature that want to do the right thing.